He has actually come to see whether he can have a help of the growth in his head.
Yeah, we see some bizarre things, and that makes it obviously extremely interesting, like things like elephantiasis, where the leg swells and it really looks like an elephant's foot. We see severe trauma, burns. Sometimes we'll see huge tumors of the face, of the neck.
Now, did he already see the doctor or see something about this?
It's been several years now that my husband and I have been going off together as a team and coordinating multidisciplinary teams coming into different countries, this time being Kenya. We have seen a lot of growth in the number of people coming on the teams, and it's been something that was part of getting started in it, was part of something that we had discussed when we first got married that was really important to us to go out into the world. We've always gained a lot from it and felt that it really makes a difference. Mom, the baby is 4 months old and she's breastfeeding, but the baby now has diarrhea. She comes to you and she's got this problem. What would you do?
And along with this, we've added a whole element of education. So we have a village healthcare worker program, which my wife is organizing. And we also have a program for the medics, that training the medics, the guys that are out in the remote areas of the Masai Mara who don't get a lot of attention, and so we're training those guys as well.
It's about empowerment of them to now take control and to improve their communities, and then of course their quality of their lives, and cut the rate of death within their community as far as the death of children and with preventable diseases.
You know, I've never seen cholera, and you guys have probably all seen cholera, have you? Yeah, so, you know, you already are, if you lived further away, you'd be the experts. We are undermining the local people a little bit when we show up. Their belief, the lay people's belief, is that we have the answers and their local guys don't. Really, it's the other way around. The local guys are the experts. We can help the local guys because we have a little more training in some areas. But if I think I'm going to teach them about a tropical disease, that's completely wrong.
Can you explain to her that her lip will go numb to the middle and her tongue on this side should go numb too? Oh, it's quite diverse this time. It's the largest medical group that we've had. We have 2 general practitioners, physicians, 1 radiologist, we have an ophthalmologist, and we have a pediatrician. So a good array of medical professionals. We have physiotherapists, we have nurses, we have speech pathologists, and I'm just a small component on the dental aspect of it. Most of what we do is extractions, though that's not my preference. I would rather be doing fillings, and it just depends how much time you have. You do what you can.
The way it works is we can go on a game drive in the morning, 6:30 in the morning. We're back here by 8 o'clock. We have breakfast. We're at clinic, you know, depending how far we have to drive, but we're at the clinic in a reasonable time. We work until, well, the medical team sometimes misses the afternoon game drive because we work sometimes later. But, you know, the opportunity to go out and see the animals and also to have an experience with the local people is there. And I think that's the magic of these trips.
If you can't see it, it's okay. Are you having a hard time?
So I think that everyone can contribute, medical and non-medical. We use lots of people that have absolutely no medical, have no medical background to help with crowd control, to help with registering patients and things like that. So everybody can have an experience, and you know what, it'll change your life.
Well, it's a drop in the bucket because you see such poverty. It's also very challenging because we're used to dealing with problems with far more resources. So you're overwhelmed by numbers, but you're also overwhelmed by not having the tools that you would normally have. You become a little bit hardened to some of the difficulties that you see. I guess that's a necessary evil, but you can't be preoccupied with one sad case when there's 10 more waiting. We try and do what we can do, And I think the biggest impact that we can have is by improving the education and contributing to the resources that the local people have, who are here 365 days a year. 4 hours for everybody. Okay, well, that sucks. I mean, that's hard. My help is only an hour away, okay? We're not here for our own job satisfaction, but it's not very satisfying when you know you have to leave so many people that haven't been seen.
There are times when you feel that you haven't done enough, and that, I guess, is in realizing that there is so much more that can be done.
The back is along this side here, and the limbs are over here.
Yeah.
There's her umbilical cord, so she's got a normal 3-vessel cord.
Yeah.
We've seen nothing but growth. We started with, on the first trip there was 4 of us on the healthcare team, and on this trip there's 23. You're here learning about TB, you're here learning about water and sanitation and personal hygiene. You're going to want to take that back and then start to mobilize your community.
You know, it may be a drop in the bucket, but I've read that $4 billion is all it is required to provide fresh, clean water, drinkable water for every person on the planet. And $4 billion is the amount that is spent on perfume every year. So we can actually contribute more than a drop in the bucket. What's required is that for every small community in the West to think about a small community in a developing country.
It's the first time to come to a clinic that has an ultrasound. It's great to see them. It's a relief to us.
I'm encouraged because I know it is making a better world.
But it's nothing to worry about.
Very good.
Okay.